Hi, my name is Manoj Krishna. I'm a spine surgeon, and today I want to present a story of a 38-year-old lady who first started getting back pain after the birth of her baby. Uh, this is quite common, and usually it settles in a few weeks or months, but in some cases, like in Joanne's, it became intractable, and she'd suffered for 3 years before she saw me. Her MRI scan, as you can see here, showed a degenerate disc at the base of the spine with a disc bulge, and she was tender in the base of the spine, and she couldn't sit comfortably or bend forward to pick her son up. She tried a whole variety of non-surgical treatments, including a lot of physiotherapy. The cross-section across the disc here shows a disc protrusion, and I operated on Joanne because we tried all the other non-surgical options available and did a posterior lumbar interbody fusion at L5S1, where we took out the disc, put a cage filled with bone into the disc space, and put some screws and rods in. The surgery takes about an hour and a half, and she's in hospital 2 nights. Here's Joanne telling a story. Morning, Joanne.
Good morning.
So, how old are you, honey?
I am 38.
38.
38, yes.
Don't look that at all. Okay. So, Joanne, please tell me a story about your back problem.
Okay. I've had ongoing back problems for about 3 years, which were multiplied after the birth of my child about 18 months ago. And following quite a complicated birth, I had excruciating pain. So I had sort of sciatica pains down both sides of my legs, running right the way down to my knees constantly.
Okay.
And really bad sort of mobility. And
And what treatment had you tried in the 3 years before you saw me?
So I'd had extensive physiotherapy. I'd had sort of back care sort of programs that had been developed for me, which were just around exercise and keeping myself mobile and pain medication.
So you were on a lot of painkillers, physiotherapy. How did it affect your quality of life? What is it that stopped you doing, or?
At the beginning, it wasn't too bad. It was just something that you got used to. Painkillers would take away the pain, and so it didn't really have a huge impact.
Yeah.
But then after the birth of my little boy, it was getting to the point where I couldn't bend over and pick him up, and I couldn't hold him, which was just
it's tough.
Horrible.
Okay, so we tried all that. We did a scan that showed the bottom disc in your back had gone, and we did a posterior lumbar interbody fusion about 3 months ago.
Yes.
So please talk me through, were you anxious about surgery?
Very anxious. I was very fortunate that one of my really good friends had a similar operation about 15 years ago, who was very sort of knew all the lingo, so she was able to explain everything that was going to happen, and so I was very, very fortunate about that. Otherwise I would have been exceptionally nervous, and I might not have actually gone through with it without that.
I think sometimes the fear of treatment can be more than the problem itself.
Yes.
And it stops a lot of people from getting help.
Yeah.
Okay, so the surgery was 3 months ago. So talk me through your surgery and how you got on after.
Surgery, can't really remember it for a couple of days, to be fair, but I can just remember having a very, very stiff back when I was in hospital. The care that I had was absolutely fantastic. All the nurses were really, really nice and helped me to get out of bed and to start moving around. But I was really surprised how quickly I was actually able to get up by myself, walk around, walk up the stairs, walk down the stairs.
The next day, I think.
Next day, yeah.
You went home, I think, 2 days later?
2 days, yeah. I was in here for around about 36 hours maximum.
Yeah.
It was
so you're now 3 months from surgery?
Yes.
So please talk me through your recovery and how you are now.
Okay. The first couple of weeks was very much a case of getting tired very, very quickly, so doing a little bit of walking, pottering around, but not any heavy lifting. But as the time's actually progressed, things have just got really back to normal. I was walking a mile a day within sort of 2 to 3 weeks, and I've got within 6-7 weeks I had full mobility back, pain-free completely, and I can pick up my little boy and throw him around just like I did when he was like a wee tot. He's enormous now.
Yeah. That must be really.
It's amazing.
Fun.
Yeah, and I don't have to worry about if I do something, am I gonna get stuck in a spasm, or
Yes.
am I gonna have any pain? Because I just know I'm confident enough to be able to do anything that I want to.
And you're off your painkillers?
Off my painkillers, yeah,
And back
no
in
pain.
the gym doing aqua aerobics?
Yeah, back to normal, yeah.
Okay.
Still doing my physio and my Pilates, just to maintain that, that core strength. But yeah, everything is just back to normal, and just can't wait for the summer and to get out there and really sort of put good use to it.
Okay. Thank you so much, Johanne.
Okay, thank you.